Welcome. My name is Jamie Shifley. I am a registered dietitian here at Wellness House. And today I am going to be talking about managing nausea and vomiting during cancer treatment. It is a very common problem, and we want to make sure that it is addressed if it is a consequence that you experience. So let's go ahead. I'm going to start by sharing my screen. Okay. So nausea, in case you don't know, is the feeling of being queasy or sick to your stomach. So this doesn't always have to happen with vomiting. You can feel nauseous and just uneasy and not necessarily throw up. Sometimes they go hand in hand, but not always. So that's nausea. And then obviously vomiting is ejecting, throwing up, getting rid of the contents of your stomach, or at least your body attempting to, even if there is nothing there. And the problem with nausea and vomiting is that it can make it difficult for you to get the hydration and the nutrients and electrolytes that you need in order to stay strong and stay healthy. So it can lead to dehydration, electrolyte imbalances, weight loss, and even depression. So it definitely needs to be addressed, and severe vomiting can sometimes lead you to have to stop your cancer treatment and take a pause for a while. Thankfully, there are many treatments. We're going to talk about different things that you can do. And as far as causes of nausea and vomiting, there are many different causes. So it could be the type of chemotherapy. There's certain chemos that are more likely to cause nausea and vomiting. Or the dose. The higher the dose, the more likely you are to have nausea and vomiting. It could also be how frequently you're getting the chemo delivered, or the way you're getting the chemo delivered. So if you look at that bottom bullet there, if you're getting an IV, that's more likely to cause nausea and vomiting because it causes faster absorption. And if you're getting radiation, especially to the spinal cord or the abdomen or the pelvis, could be a potential cause. Sometimes just experiencing pain from the actual cancer, pain from surgery, pain from your treatment. Sometimes that pain is so severe it leads to some nausea and vomiting. Or you may be really fatigued, and that could just make you to feel sick or uneasy and cause you not to want food. Or you could have an active illness aside from the cancer. So you might have an infection or a GI illness, something in your digestive tract that's causing you to feel sick. Certain medications, especially pain medications, if they're taken on an empty stomach, can lead to some nausea and even vomiting. So you always ask when you're given a medication, is this likely to cause nausea and vomiting? And then if that happens, what can you do? It could be stress related. Cancer, having a cancer diagnosis, going through cancer treatment and being scared can be stressful, and that can lead to feelings of nausea and even vomiting. Lack of food. So ironically, if we're not eating enough and our stomach is empty, that can actually lead to some nausea. Or it could be an electrolyte imbalance, often due to dehydration, that can lead to nausea, feelings of nausea. So if you have nausea due to chemo or radiation, they often give you a prescription. There's lots of great medications out there now, and they often tell you this is the timing of when you should take it, around when you're getting your treatment. So definitely talk to your doctor and ask them what the best plan of action is for taking those medicines. As far as other tips for managing nausea and vomiting, eating several smaller meals throughout the day can often help. As we talked about earlier, being on an empty stomach, sometimes that empty stomach leads to nausea. So for kind of keeping food in there more regularly, it can help you not feel as nauseous. So instead of 3 big meals with big periods of fasting between, just try and dose that out a little more regularly throughout the day. If it is affecting your appetite and you realize that you're really not getting in enough either liquids or foods, definitely try and sip on a beverage that has calories in it to just up those calories throughout the day. And that could mean a juice, or it could mean a shake, or some other sort of nutrient replacement and calorie replacement. If you do experience vomiting, you want to be sure to drink clear liquids post-vomiting to prevent dehydration. And that can also help clear out your mouth so that you don't have that bad taste in your mouth, which can lead to more nausea. So we want to kind of wash our mouth out and help that feel a little bit better. And as far as foods that you choose, if you're feeling nauseous or you've experienced vomiting, you want to eat bland foods. You don't want to go to really sweet or fatty, greasy, spicy foods, which can be just a little bit harder on the stomach. We want to go for light, easy foods that are easy to digest. So things like crackers, toast, dry cereals, breads that just go down easily are best. And then if you're taking medication, you want to take those with your medication. Also certain candies, so like lemon drops or other tart candies can often help relieve some nausea and also get rid of that bad taste if you have it in your mouth. We actually recommend not eating favorite foods if you're having nausea and vomiting because you can develop an aversion to them. So we recommend just trying to stay away from those favorite foods so that doesn't occur. And while you're eating, just try and stay calm. Even if you are feeling a little nauseous, creating a peaceful, relaxing environment can help you hopefully ignore and forget some of those feelings of discomfort. Trying some other alternative treatments or measures for nausea, like C-bands, which people use for seasickness, and you can get those just over the counter at most pharmacies or large stores like Target or Walmart or Walmart. What they actually do is apply a little bit of acupressure to a certain point on the wrist, and some people find some relief from that. As far as eating, you want to just try and eat slowly. That gives your body a little bit more time to digest and not feel overwhelmed, especially if it's already upset. Then you want to try and sit upright for about an hour after you eat. That helps gravity work its magic and helps you digest a little bit more easily. And if you are having trouble getting in enough because of nausea and vomiting, you want to not drink liquids during mealtime because that's going to fill up your stomach and you might not eat as much as if you didn't have any liquid with that meal. So drink liquids outside of the meals, but not actually during mealtime. And if you're going through chemo treatments, you want to avoid eating about 1 to 2 hours before chemotherapy because usually the worst of the nausea and vomiting is right after that chemo treatment. So you're more likely to experience nausea and vomiting, so we want to not have too much food in the stomach at that time, unless your medical team says otherwise. And if odors are really giving you a lot of discomfort and trouble, you can try and eat food that's either at room temperature or cooled down, because hot foods tend to have a stronger odor. So if you keep them cool, you're not going to get as much of that smell. And eating in well-ventilated areas, or if the weather's nice, eating outside, and then avoiding strong odors such as perfumes, aftershaves, really strong lotions, things like that, because they're really going to contribute to that nausea if you're experiencing it. Or cooking outside, so cooking on the grill when it's nice, or using boiling baths inside, or just trying to use methods that don't cause as many odors. Another tip is ginger. Ginger has been found to be a really powerful anti-nausea food. So just cooking with fresh ginger root can help you get those benefits. There's also lots of great ginger teas and ginger candies. So look for those. If you just go on the internet, there's lots of great ginger candies out there, or the pharmacy should have some too. And then if you really can't control it with these other methods that we've talked about, don't be afraid to talk to your doctor. There's lots of great medications that have come on the market in the past few years, and they can really help prevent that nausea and prevent that vomiting. And that can help you make sure that you're staying as strong as you can, that you're getting the nutrients that you need, that you're staying hydrated, so that you can stay strong through your treatments and really fight this disease. So we hope you found that helpful. And as always, please do not hesitate to reach out to the nutrition team at Wellness House with your individual questions, and we are happy to help you. Thanks so much.